Thank you so much, Teshia, and great to see you all here, because we thought we'd have 3 people, given that we're near the end of the conference and it's after lunch. Yeah, I'm really excited to be part of this panel and to have these important conversations. I really feel like it's been a beautiful gathering of our movement over the last 3 days, and it feels so needed in this moment of such political turmoil and geopolitical fracture that we're all seeing. Yeah, so happy to be here with all of you. So IDPC, for those of you who don't know, quickly, we're a global network of around 190, oh, sorry, I need to press it on here too. NGOs from 70 countries. We're working to amplify and strengthen a global movement to repair the harms caused by punitive drug policies and promote just responses. And we work hard to facilitate civil society engagement in drug policy spaces. And you can see we have family gatherings wherever we meet. So this was the IDPC network's members meeting yesterday morning at 8 a.m. So you guys are gluttons for punishment. So my presentation today is, yes, as Teshia said, it's really to talk about our decriminalization advocacy, a bit of background, where we've come from with it, where we're going with it, the challenges that we're currently facing, and how we might shift our messaging and our narratives. I think what we did well, which I'll start with, is that we really worked hard to have strong, sustained advocacy for decriminalization. And we started to see a trend towards governments taking up the debate, moving towards decriminalization initiatives around the world, and a growing global and UN consensus that decriminalization of drugs, possession for personal use and drug use is the way forward and needed. We started to evolve our messaging as this happened. We, as IDPC, I'll talk about a bit about in a minute, we came up with a gold standard for decriminalization. We needed to provide greater technical detail and capacity strengthening. And then, the world, prohibition was still going on in the background. And, I don't know, I will take responsibility also in my advocacy. I don't know that I kept up with what was happening in terms of the drug market and the pushbacks. So I think, maybe what we need to do better, and that's what I want to talk a bit about today, is articulating a decrim kind of 2.0 in a deepening crisis of prohibition, the clear failure of capitalism that we're all facing, and reframing narratives and resistance. So where did we come from? IDPC has been advocating for Decrim since we were set up in 2006. And we really started to urgently articulate the harms and failure of criminalization. This was very strongly linked to HIV/AIDS advocacy. In fact, in 2009, the UN Secretary General on World Drugs Day declared that he urged all countries to remove punitive laws, policies, and practices that hamper the HIV response. And he noted that in many countries, legal frameworks institutionalize discrimination against groups most at risk. So as far back as 2009, that messaging was starting. The other thing that we had to do back then was establish that the decriminalization of drug use and possession for personal use was permissible under the UN drug control treaties. And that was something at the time that was not accepted clearly. So we really had to lay that out. And then, as I said, as governments got more interested, we had to get more technical on the details, what did the model look like, and we had to start tracking some developments. And just a shout out to my colleagues at Release who really started to do that work back in 2012 and again in 2016. And this led to a Decrim map that you can follow on Talking Drugs, where we work together to track these developments wherever they're happening. And then, of course, consider the Decrim position across the IDPC network, gain consensus among our members, also on the model, how it should work, and do training and capacity building. So that's kind of where we've been. And then I think, the success has been, building on that global sort of high-level, UN-level support for decriminalization from all of these institutions over the years. And I also want to credit Palani, who's on the panel with me today, for adding Global Fund very strongly to that list when he worked there. So we're building support and consensus. We also have now, across the UN system, lots of human rights bodies and mechanisms coming out and speaking in favor of decriminalization, making it very clear that we cannot continue to criminalize people for the use of drugs or personal possession of drugs. And, you know, I mean, this is an impressive list, and it's taken a lot of advocacy from many colleagues, you know, many of whom are sitting in this room and beyond. So the jurisprudence, in fact, I would call it, from the UN human rights system is really clear. And in parallel, we also got, on the UN Common Position for Drugs, it really means that the 31 UN entities are signed up to this. So that was a huge win in 2018 to get the UN Common Position on Drugs that specifically mentions the need to decriminalize. However, I still would say that UNODC are not quite there yet, although they do sign up to the UN Common Position and lead it. And this is a paper that you can still find online that they did try and release in 2015, but then rescinded it and still felt like they couldn't say it so openly. So we're still pushing for that. So more and more countries are moving towards decriminalization. I mean, it is a trend that we see. And you can see here that, you know, out of the 59 jurisdictions that we have, half of these happened in the last 10 years. So it seems to be an accelerating trend. Of course, you know, as we heard earlier already, we know that models vary and that, you know, in many cases it's far from perfect. And that complicates our advocacy, right? Because ultimately it is a red line for IDPC. You know, first and foremost, we want full decriminalization. So for us, we developed the gold standard of decriminalization, that's what we call it. And the idea is, you know, absolutely to have all sanctions for drug use removed, criminal or administrative, and for all substances as well as related activities. So activities of what we call, say, low-level supply, social supply, personal cultivation as well as personal use. Promoting voluntary access to systems of care and support, meaningfully involving people who use drugs at all stages, of course, in the design, monitoring, and delivery of these services, of harm reduction services. Importantly, and this has not happened everywhere where decriminalization has been instituted, to expunge previous convictions and develop reparations for affected communities. Train authorities to ensure implementation and adherence, like everyone who needs to be involved understands what the policy says and how to implement it properly, especially the police who often remain involved in decriminalization policies. And then, of course, the funding issue, right? I mean, we cannot decriminalize and then not put any funding into healthcare and harm reduction and drug treatment services. So quickly, how does Decrim work? This is what we say. Which drugs are decriminalized? All drugs. Which activities are decriminalized? That's what I was sharing earlier, not just possession for personal use and drug use, but also the other associated activities. How do we know if it's possession for personal use? I'm running through these so quickly, but you know, you can read it in our Decrim guide or come and talk to us later. Of course, the thresholds are always the thorny issue. And they must only ever be indicative when we're trying to decide if it's for personal use or for supply, but complicated. And also complicated is who decides if it's for personal use. This is also very complicated, but in a no sanctions model, arguably the police have the discretion just to leave people alone, unless another crime might be suspected. But all of this was happening, I think, while we were working on this in a deepening crisis of prohibition, you know, and we were very much focused on making our arguments for Decrim, arguing for the different models, really trying to get information out there, capacitate the network to talk about it. And of course, you know, the overdose crisis or, you know, the crisis of a toxic, unregulated supply continued unabated in the background. You know, and then, of course, the HIV/AIDS epidemic still continues. I mean, UNAIDS reported in 2022 that the risk of acquiring HIV was 14 times higher for people who inject drugs than for people in the overall population. You know, I mean, and that's a direct result of criminalization and lack of access to harm reduction services, the stigma, the discrimination. I mean, the overdose crisis in North America, or the increasing overdose deaths, is devastating. And I think I don't really need to repeat the numbers in this room. I think you're all aware of that. So when we're advocating for decrim, and then some jurisdictions are taking up decriminalization in this context, and we're arguing still on the basis of like, it's about the right to health, and it's about ensuring we reduce stigma and discrimination. But I think it got, perhaps potentially, I'm not sure. I think we have to take some responsibility, and I'm not criticizing any colleagues for how we talked about it, but that we overpromised somehow what Decrim might deliver because we were so enthusiastic about it. We needed it to work. We wanted it to happen. And we ended up, for so many reasons, so many complex reasons, facing this backlash against decriminalization that we see today. Okay. And, I think, we've been hearing about the US, of course, with Oregon, with BC. In both cases, there were powerful and problematic disinformation campaigns to undermine these initiatives. Decriminalization was blamed for massive structural problems that also coincided with the COVID pandemic, especially this is the case in Oregon, a housing crisis, evictions, poverty, inequity, and of course, ultimately, an unregulated and toxic drug supply. And actually, despite this, in both cases, even in the short time that the policies were implemented, there were clear beneficial outcomes, right? Decrim works. In Oregon, there was a massive reduction in arrests for drug offenses, as well as increased funding for health services. And in BC, the same. Arrests for possession fell by 76% in the first 6 months of decriminalization, which was exactly what we wanted it to do. But it's just one part of the response. And the driving forces behind overdose, homelessness, and public use remain unaddressed by decriminalization. And then, of course, in the background for this, the Portugal example, which was always the model that was held up, was also then being subject to questioning and scrutiny and blamed for public drug use and, we don't feel safe. And why? Why do we have public drug use? Well, there's a crisis of homelessness. People are unhoused increasingly in all the jurisdictions that we're talking about. Homelessness has massively increased. And thank you for this report from the Global Commission in 2024 that where I've got this slide from, which you can also check out. It's called Beyond Punishment from Criminal Justice Responses to Drug Policy Reform. And it's contagious. So Kokila, I'm so glad you're here. I'm sure you may recognize this, but this is the Central Narcotics Bureau of Singapore. Their website, which somehow is like in celebration, it seems, for Drug Victims Remembrance Day, now outlines, you can go there and outlines the problems of drug liberalization, and then there very clearly Oregon, British Columbia, Thailand's there actually too, you see on the side, because they have a sort of cannabis liberalization policy. But they're using these arguments. Our detractors are using this against us. So we have to re-clarify the objectives and the impact of decriminalization. What can a decriminalization policy address, right? We have to be super clear about that. Stigma and discrimination, improving access to health, harm reduction, drug treatment, alongside adequate funding, reducing interactions with police and the criminal legal system, ensuring the right to health, of course. But it won't fix a toxic drug supply. It will not fix a housing crisis, and it will not address the underlying structural issues of inequality, poverty, gender, racial discrimination, the damaging colonial legacy, and the failure of capitalism. So what do we need to do now? We need to not be on the defensive. And then I was like, oh my God, the title of my presentation. But, that's where we still are, right? Like sometimes I get asked questions by journalists. They're like, why didn't Decrim work in BC? And I'm like, well, blah, blah, blah. And then I'm like, wait a minute. I'm not going to answer the question like that, right? Decrim worked. So we have to be so clear about our language. We need to be clear about who and what has caused a crisis of unregulated and toxic drug supply. Decrim cannot be the scapegoat for over a century of prohibition that drives drug markets in ever more harmful directions. We need Decrim, but we need so much more. We need to advocate for drug consumption, safe injection sites, drug checking, safe supply, legal regulation, alongside housing, employment, education, and addressing structural inequality. And we need to be in solidarity within our sector and across the globe and across other sister movements. Just some resources that we have. So please visit our website, the interactive map that I mentioned on talking drugs, our advocacy guide on decriminalisation, a briefing that we've done, and we have an e-course as well that has been, over 1,000 participants have gone through it. We're currently lacking funding for it, so its future is a little uncertain, but we're going to find a way to continue it. Finally, just wanted to say in closing that, we're living in such a moment of deep political uncertainty and rising political danger everywhere. All of our work, all of our communities are under attack. So please, let's be in solidarity with each other, with our sister movements, with dear friends living under fascist regimes around the world. The future is not written. Nothing is inevitable, and we are not powerless. Thank you.